We have two choices. We can do a national lockdown, which I don't think there's any political appetite for, or we can get a lot of people vaccinated very, very quickly. I would love to see every person over 65 who wants a vaccine to be vaccinated in the next 6 to 8 weeks. We're going to need to be doing millions of doses a day in order to hit that.
Well, Dr. Ashish Jha, thank you so much for taking the time today. Really appreciate it.
Hey, thank you for having me on.
So we're talking to you just as the Biden administration has taken over. They've laid out a plan to do 100 million doses in 100 days. Does that on its own seem doable to you? And if so, is that a pace, about a million or so a day that is going to be fast enough here?
So first of all, I think it's doable. They are left with without a great plan from the Trump team and without a lot of stockpiles. So there's going to be a lot of work to get there. But I do think they can do it. Unfortunately, I'm worried it may not be enough. The Trump team had promised that 50 million people would be vaccinated by the end of January. We're at 17 million on the 21st of January. We're not going to get there. So given everything that's happening, I'm pretty worried that 100 million per over 100 days, while achievable, it may not be enough to keep us out of trouble.
And let's say we do get to that point, that minimum, say a million or so a day. If we continued on that trajectory, about how long would we be looking at to achieve herd immunity in the country?
Well, if we just do the math, if everybody needs 2 doses, if we say with Moderna and Pfizer, if everybody needs 2 doses and we need to vaccinate 300 million people, that's 600 million doses. That's that's almost 2 years. So obviously that's not acceptable. And the Biden team would never say that it's going to take us 2 years. I think they're thinking 100 million doses in 100 days to start with, but it's going to have to ramp up more than that after time. And my sense is that they're going to want to make sure, and I want them to make sure, that anybody who wants a vaccine can get one by May or June, and that a large majority of Americans are vaccinated by the summertime. That will mean we'll have to really go much above a million a day.
Yeah, and so along that course, there are some challenges of ramping up. At this point, many more doses have been shipped out to states than have been administered. I think the ratio right now is something like 30-something million to 17 million. What do you see as the source of the mismatch that exists there? And do you see signs of improvement since we've started?
Yep, both. So I do see signs of improvement, but there are still some challenges, right? So the first question is, why have states been so slow? Why has this gone so slowly? And the short answer is because the federal government did zero planning, put no resources in, did not help the states, and said to states, you're on your own. And no surprise, states have not, didn't hit the ground running. The good news is states are getting better. Over the last week, we've been seeing kind of 800,000, 900,000 a day from states. The states, what things that are slowing them down still, there's a lot of complex rules. States don't have enough staff. They don't have enough resources. Again, all places where I think the federal government could help. Left unto itself, I think states will kind of plod along and do okay. But the Biden team's been pretty clear. They're going to put the resources in from the federal government, FEMA, Public Health Service, National Guard, or other sources as needed, and a lot of dollars. Put all that into states. I think you're going to see states really be able to ramp up a lot more.
So in an ideal situation, how many shots per day would you want to set as a goal? Let's say there aren't limitations to supply or distribution or, communication between federal and state resources.
Yeah. If there were none of those restrictions, Gideon, and I'm going to drive the Biden people crazy by saying this, we really should be vaccinating 2 to 3 million people a day, because we got a problem, which is this variant that is the UK variant that is starting to circulate in the United States. It's a bad variant of this disease. It is far more contagious. It is going to cause a huge spike in infections. And we have 2 choices. We can do a national lockdown, which I don't think there's any political appetite for, or we can get a lot of people vaccinated very, very quickly. I would love to see every person over 65 who wants a vaccine to be vaccinated in the next 6 to 8 weeks. We're going to need to be doing millions of doses a day in order to hit that.
And going back to some of the isolated places that have been running through their vaccines more quickly than others, we saw examples in places like San Francisco and New York where they were talking about running out of doses. And that's while some of these other ones have been sitting on the so-called shelf, if you will, in other places. So When you look at those two separate examples, is this an issue with what the companies are able to produce, distribution from the federal government, or some kind of combination of both?
So let's talk about why there are vaccines sitting on shelves, for instance. There are a lot of
Hmm.
places that have not been able to get nursing homes and assisted living facilities vaccinated because of very complex rules and contracts they've set up with pharmacies and when can pharmacies go in and et cetera. And so that's one part of why we've got this like backlog. And then you have places setting up vaccination centers like New York and San Francisco that run out of vaccines. They don't have enough
Hmm.
vaccines. And there are two parts of the problem there. One is we literally still have vaccines sitting in freezers for Pfizer, and the federal government has not asked them to like send it to New York and San Francisco. That to me is crazy, right?
Right.
It's crazy. And again, all these conversations I've been having with people was with the federal government last week. So of course it was a different federal government, right? And my sense is, and I've talked to the Biden team, they're not going to tolerate this kind of stuff, and they're going to start getting those vaccines out. So I'm hoping that whatever vaccines are sitting on shelves get out. But the second part is you can only manufacture this stuff so fast. And
Right.
Operation Warp Speed, which was supposed to do all this stuff to make sure that we had hundreds of millions of doses, didn't actually do all of that. And so we don't have hundreds of millions of doses. And the Biden team is going to have to put some hard work into figuring out how do we use the power of the federal government to ramp up production. And I don't know that there are any easy answers there. This would have all been easier if they had, if the last team had been actually working on this for many months. But that's going to be a different part of the problem to solve.
Right, right. And to the point of the variant, there, were other places like the UK taking an approach where they get first shots out to more people, or at least that's what they were talking about. I don't know exactly where they are at the moment, and delay the timing of the second dose if necessary while their supplies are limited. Where do you fall on that particular strategy?
Yep. This has been a little bit controversial.
Hmm.
First and foremost, everybody should know that everybody needs 2 doses. So there's no
Right.
like 1 dose strategy. The strategy question that comes up is, do you give 2 doses by 28 days, which is what was studied in the clinical trials, or do you live with some proportion of people getting vaccinated, let's say a week or 2 or 3 later than ideal, as a way to make sure that you get all the vaccines out? So if you have, let's say you have 10 million doses, you can give out 5 million and keep the other 5 in reserve, or you can give out all 10 million and then hope that your production keeps up so that you can get everybody their second dose on time, but not sweat it if somebody's a week or 2 late. I am
Right.
more of the latter category. I feel like it's very reasonable to let things, if things are delayed by a couple of weeks, it's not a big deal. I don't want to delay by months.
Hmm.
I definitely do not want to only do 1 dose. You got to do 2. But I think it's totally fine if everybody gets their second shot within 2 months. Um, but there are people who really are uncomfortable with that. The clinical trials really only looked at 28 days. Again, I think there's good scientific reason to think that what I'm proposing, what many of us are proposing, would be okay. And it would have the huge upside of being able to get all the doses out into people's arms and get that first dose in. But it does make people uncomfortable, and I understand that.
Right. And to the point of the variants also, and the question of vaccines and treatments that are existing in the world right now, how concerned are you about those new variants? I understand, there are different ones, South Africa, the UK, in terms of how the vaccines and the treatments are responding to them at the moment.
Yeah, it's a very good question. And the short answer is it's a moving target. We don't know for
Hmm.
sure. But all the evidence I have seen through this morning, there's some more data coming out this morning. All the data so far suggests that the UK variant is going to be susceptible to the vaccine, meaning the vaccine will protect people against the UK variant. There's some data that the South Africa variant may be a little bit trickier, but again, I think our vaccines are going to provide a good level of protection. And then we can change our vaccines. We can actually make changes in our both Moderna and Pfizer vaccine to be more responsive if it ends up being that our vaccines don't work. But so far, all the data I'm seeing suggests that our vaccines are going to work. But this is one of the reasons we got to get these vaccines out very, very quickly into people's arms. They certainly aren't working if they're sitting in freezers.
Right. And to go back to the dosing schedule conversation for just a moment, what is the main discomfort with delaying the second dose? Obviously, we only know effectiveness based on what has been tested, but is that the primary discomfort?
Yeah, it's a little bit like how do you see science? And there's one group that says, look, we've only studied it in this very specific way, and I am not comfortable going off of that at all.
Mm-hmm.
And there are those of us who are, to use kind of a judicial term, like less of a strict constructionist, right? Like,
Right.
or like, I understand that's how it was studied. And in the ideal world, we do it exactly that way. But turns out we're not in an ideal world. We're in a crisis where 3,000 to 4,000 Americans are dying every single day. And in that context, I can look at the data and I can see that out to day 28, one dose provides 80 to 90% protection. There's no reason to think that like on day 29, that protection is going to collapse.
Mm-hmm.
We should feel pretty confident based on what we know about vaccines that we probably have protection out to a couple of months. Hey, like let's use what we know about science to get more doses out to people. But there are people who think in a crisis, we should really stick narrowly to the data. And I'm sympathetic to that argument. None of us have proposed this lightly. In the ideal world, we wouldn't do it at all. We'd stick totally to the schedule. But I do think it's pretty reasonable to let it slip a little if it means we can get a lot more people vaccinated.
Right. That seems like the trade-off that is logical in this situation. I also on the topic of variants, I saw some limited reporting on this that there were some European countries that are discussing the necessity of higher grade medical masks given the contagiousness of the new variants. What do you make of that? And is that something that should be discussed here? Because I think one of the large concerns that people have right now is what the United States might look like in March or springtime if this is the dominant strain that exists.
Absolutely. Look, I think we're still underestimating how big a deal this variant is. It's really bad. And you can look at the data from the UK and get, and that should make you nervous about this. UK has turned things around by doing a very vigorous national lockdown. I don't see that happening here. So if we're not doing that, and we've talked about vaccines and how do we get vaccines out, but what else can we do? I do think upgrading the quality of mask is going to be really important. I even over the summer used to wear cloth masks all the time and not worry about it. I have upgraded my own mask wearing. And then as the variant has started really coming into play, I started rethinking my own strategy on masks. I think cloth masks are probably not enough for any high risk situation. Look, if you're out for a walk with your dog, a cloth mask is fine, as long as you're not in a large group. But when you go inside a grocery store or some other place that's more high risk, you should be wearing a higher quality mask. So what might that mean? There are KN95s, KF94s. I wear a KF94. These are made in South Korea. They're really pretty high quality masks. You can buy them on Amazon. You don't need any like special, but also in really high risk situations where you're going to be in a room with 10 other people. First of all, you should try to avoid those. But if you are, double masking is another way to do it, where you wear a surgical mask followed with a cloth mask on top. But ultimately, I want more and clearer guidance on this stuff from the federal government, from the CDC. I want to help people buy and wear more high quality masks. That's going to end up making a really big difference. So I think there are lots of things the government could be doing to be helpful to people here in terms of sorting out quality of masks. Most people can't sort this stuff out on their own. You really do need expertise on this.
Right. I completely agree with that. Yeah, they're, more clarity, the better. Well, Dr. Ashish Jha, thank you so much again for taking the time today. I sincerely appreciate it.
Thank you for having me on. It was a lot of fun.